We can't hear anything. Dear doctor, your name was given to me by my dear friend, Dr. Giuliano. Looking forward to see you personally. I'm sending you a list of disturbances that I have, disorders, and a report of a visit on the 19th of October 2009. My current problem, apart from the tumour, is the delayed effects of radiotherapy. Over the last 2 months, having had the last radiotherapy session in June 2008, I had a gradual worsening of the swelling, which had been bothering me for some time and which I was controlling with 32 drops of Sol-Desam per day. The swelling began to stop regressing during the day, and the neck, particularly on the left, became as hard as a rock, such as to make me feel like I was suffocating. The last MRI showed fibrotic tissue, and the radiologist asked me to have an echo Doppler test because the internal jugular blood flow appeared to be interrupted. The echo Doppler test found that there was no thrombosis, but that the flow was filiform, causing compression due to fibrotic tissue. The next cardiological exam clarified that this was post-actinic fibrosis, the therapy being heparin injections. My quality of life problems at present are comprised of abnormal swelling of the face, moon face, very hard neck that prevents me from rotating my neck normally, difficulties in swallowing, and a terror that the situation could become even worse. Please bear in mind that I can no longer sleep in a bed because after about an hour I feel like I'm choking. Therefore, I sleep almost on my feet, sitting on a chair, or partly reclining in a lounger. As you can see from the Nollet report, I'm waiting for their decisions about possibly starting therapy again, but Dr. Nollet would not like to worsen the fibrotic situation. I hope that you can do something to relieve my problems, and therefore I ask you, please, to give me an appointment as soon as possible. Looking forward to that appointment, I thank you. I'd like to tell you that you are my last hope, because everyone is skeptical about any possible improvement from the post-actinic delayed complications. Thank you. Ernesto Paolini. What you heard was a patient, and that's the kind of suffering that our patients are enduring. We as oncologists experience our patients' pain and would like to try and relieve them, and oftentimes, as we know, that is just not easy. However, we've tried, we've done our best to find new approaches, different approaches to what was used before. And to be scientific, how can you use a new therapy before you test it? You have to use just one approach. That's what I think, at least. That is, we have to start from the pathophysiology of the lesion and try to find some solution with new options that hadn't been used before. So this is the series of 40 cases of radionecrosis, 26 recovered between 3 and 16 months, 8 developed local or distant recurrence, 4 had hemimandibulectomies, including amputations of the jaw. Now, it all began many years before with the use of electromagnetic fields for treating pseudoarthritis, and these are evident examples of that, non-union, and this X-ray, or these X-rays, show how applying electromagnetic fields quickly repairs the lesion. The lesion is hypovascular, hypocellular, and hypoxic tissue, and very similar to osteoradionecrosis. So we decided to use to treat osteoradionecrosis with electromagnetic fields. And this is the machine that was built for a CNR project. Magnetotherapy, it promotes healing. It has an anti-inflammatory effect. It has an oxygenating and angiogenetic effect. It stimulates damaged tissue, bone tissue, for example. And applying pulsating magnetic fields, it's possible to obtain all the various effects that we're looking for. We're in a tissue, a hypovascular, hypocellular, and hypoxic tissue. So we're bringing oxygen, we're creating angiogenesis, and we're stimulating bone regeneration. Now let me show you a couple of cases. This is a patient who was supposed to have a jaw amputated. As you can see, the pathological fracture and the lack of bone stock. There's major bone sequestration, fistulae, phlogosis, etc. And the only solution, even according to the literature, this was Mark III, was amputation and reconstruction. The lady had had oxygenotherapy in the hyperbaric chamber, but this was the result. And beginning to combine electromagnetic fields, homeopathic drugs, and stimulations, bone stimulation, we obtained this result, which was absolutely inconceivable. This was another woman. This drug, I called them drug 1 and drug 2. They are very important drugs for infections. They contain a number of things that I've emphasized in yellow, Echinacea augustifolia, but particularly these two, streptococcinum and staphylococcitum in homeopathic doses. The indications are stimulation of the defense system in case of fever, tonsillitis, osteomyelitis, cases of infection. Now, this is the second drug. This is the main substance here is Myosotis arvensis, and it's applied for enlarged lymph glands, tonsillitis, angina, etc. This drug does have side effects. For example, it may modify thyroid function, and there are other effects that you can see below. This patient had been treated for malignancy, osteoradionecrosis of the jaw, as well as phlogosis for the last 5 years. The treatment I showed you before resolved the phlogosis in 5 months. Subsequently, in 9 months, using electromagnetic fields and other drugs, stimulating bone genesis, she obtained this result. You can see that necrosis is present, and here you can see the regular straight line after healing. In the mouth, the mucosa was no longer ulcerated. It became normal. The mucous membranes. This is a fistula, 180 sessions in a hyperbaric chamber already. This was a fistula, and over here, this is the osteoradionecrosis. And besides the hyperbaric chamber and antibiotics, she was also given this treatment, the treatment that I showed you before, plus arnica, that we talked about before, and these are the early preliminary results. In July, you can see the fistula closing, although there are still traces of telangiectasia, osteonecrosis persisting. And so, again, thinking about the pathophysiology of the lesion, we decided to introduce ultrasound therapy. Ultrasound therapy, again, is indicated for bone consolidation problems, and also indicated for detaching and reducing calcifications. This is an example of a calcification and subacromial bursa, and after ultrasound therapy you can see the calcifications disappearing. Ultrasound over about a month and a half resolved the fistula completely. Quite surprisingly, the resolution of the telangiectasia as well, and that's the result.